Ever heard of vaccine tourism, to visit other countries or states to get a vaccine not available at home? Well, lots of people travel the world in search of the best medical care. But in the wake of the global pandemic, is this practice ethical or is it only applicable for the elite? Well, Unathi Henama is a tourism expert from the Tshwane University of Technology. He weighs in on this conversation for us this morning. Unathi, a very good morning. Thanks so much for your time. So let's talk about vaccine tourism. What exactly is it and is it legal?
Vaccine tourism is completely legal. It's a situation where you find health tourism has developed to allow people who want to access the vaccine to go to countries which are willing to offer the vaccine. And you usually find it countries such as Cuba, such as Maldives, and also Zimbabwe, which obviously have been having faster vaccination programs compared to South Africa.
All right. So just so I heard you correctly, you said it is legal.
It is legal. It is legal.
But is it ethical?
Well, I think it is ethical because we are trying to save as many lives as possible, and countries don't have the same roll-out possibility. So, for example, Ubeka, if I've got the money, I could go to Zimbabwe and spend 200 rands in Zimbabwe and get the vaccine, which obviously will take away me taking the same money from government. So it's actually good in a way that it does not depress public finances, of which we know in the southern context they are very, very dire.
Well, Unathi, there are various sort of trends of thought around this, and one could be if I have the money, I'm obviously privileged if I have the money to be able to go to another country and take a vaccine there. But what about taking the chances away of somebody from that country who desperately needs it, who will not be able to have access to that vaccine, or taking away the opportunity from somebody else who desperately needs it in their country?
For example, if you look at the Maldives, they will vaccinate first the entire public of the Maldives and then offer the vaccine. In the case of Zimbabwe, they are offering that at a cost, so people will visit Zimbabwe and pay that cost and then get the vaccine. Yes, it does benefit the elite, of which that is true, but what is new when people come to South Africa for hip replacement, where you find that in their countries is much more expensive. So unfortunately, those are the realities upon which we live. But this is a very, very lucrative market. If we could just allow government to allow the private sector to obviously use the vaccine tourism to rebound our economy and tourism.
All right. So it seems that those countries that are offering this and offering the opportunity need to have their checks and balances in place. They need to make sure that their citizens come first.
Obviously, citizens comes first when it comes to vaccine tourism. But again, it becomes an opportunity where you can allow people from other countries to come to your country. They'll stay in hotels, they'll use the food, use transportation and benefit the economy, but they'll obviously have to pay for the vaccine. So the vaccine for foreigners comes at a cost, doesn't come for free. And it's only the citizens that get it for free. So those are the checks and balances that must be in place.
Yeah, and how do we make sure then, though? If there's money involved, Unathi, we know, sometimes when it comes to governments making that money, will they actually put their citizens first, or will they give it to the highest bidder?
I think if we allow the private healthcare system, which is world-class, to do this, obviously they've got ethical responsibilities based on the statutory organizations or which they're registered for. So I believe they would do the right thing. But obviously, to be honest, to benefit the elites. But think about this. Imagine if South Africa would allow this. Thousands of Africans would come to South Africa, pay for the vaccine, and South Africans will get the jobs once again in the tourism industry, which will obviously give them also an opportunity to procure the vaccine if the public healthcare system is still slow with the vaccine rollout. So
are we saying then that this is possibly, or it is already, the new form of tourism, because we know many countries battling now because of COVID, because of lockdown, that this would be the new form tourism is going to take? You come to our country, you come on a holiday, and you can get your vaccine as an added bonus.
It's the new way of medical tourism, because remember, people have always come to South Africa for surgery, they're coming for hip replacement. So this is an addition on medical tourism, but it would be a great way to rebound your tourism industry and ensure that the entire value chain benefits. Remember, when tourism grows, agriculture grows. When tourism grows, infrastructure and construction grows. So tourism has got a lot of deep vertical and horizontal integration into our broader economy. So if we use vaccine tourism, we would bounce back our tourism industry at a much faster rate.
All right, well, we'll wait and see what happens. And can South Africa actually pull it off without anything going wrong, without corruption seeping into it as well? Thanks very much there. That's Unathi Henama from the Tshwane University of Technology, a tourism expert and lecturer.